So, good morning. Yes, that is correct. The disease starts with a severe cold, a flu-like illness that lingers for a while the virus is replicating. And the immune system is facing it one way or another. The virus replicates while the immune system tries to keep it in check. And for some people, the immune system's not able to keep it in check. And around day 6, 7, 8, on average, in those people, it progresses into a pneumonia and potentially a very severe and life-threatening pneumonia. And this is one where people start with shortness of breath and it becomes severe shortness of breath if it's not treated, and those people usually get hospitalized. At that point, the treatments are different. If you're treating a pneumonia where the lungs are filled with the breakdown products of immune cells, then things that prevent the virus from replicating don't work. It's a different disease process. So what we have are two main stages. There's more, but at least at the outset, we have two main stages of treating the virus for its replication at the beginning. And if that doesn't work or it isn't done, then having to treat the pneumonia much more aggressively with different medications. And we know now that hydroxychloroquine and zinc and its other, what I would call companion medications, azithromycin, doxycycline, antibiotics, and so on, and maybe ivermectin as well, those medications work in the viral replication phase at the beginning of the illness. And they work very effectively when given as a cocktail that basically hammers the virus replication. That's what's needed in order to help the immune system to cope at that point. It works very well for people who need to take it. The people who need to take it are the ones whose immune system won't be able to cope with it. Those are what we call high-risk people. People over age 60 or with obesity or diabetes or high blood pressure or have had cancer in the past or other immune-related conditions. Those are the high-risk people for whom the virus gets the better of the people and multiplies out of control and needs to be treated. The low-risk people under 60 with none of those conditions, more or less have immune systems that can cope. And so they don't need to be treated. It's unpleasant, but they cope. It's not life-threatening. When you look at the studies that are only of these high-risk people and treated early, all the studies show that the medications work. There is not one study, none, that shows that the medications don't work. In those people, in those high-risk people, it is uniformly evident from every study that's looked at them that the medications work. So the question is, how do we get that into practice? And how do we get people to understand that pushback on this question arises from reasons that have nothing to do with the efficacy in the first place? It has to do with completely non-scientific reasons why people don't want to see this medication in widespread use. That means it comes from manufacturers of competing products who are afraid that this medication will work better than their products, and therefore their products will be reduced in marketability on a fair playing field in the medical arena when people start to use it. And I think that is the biggest